I'm Dr. Nussbaum. I practice family medicine. I started here in 2008. I did full spectrum family medicine in Monroe for about 15 years. Over the last handful of years, I've had a couple of different career transitions. About half my job at this point in time is physician leadership as the Director of Medical Affairs for Outpatient Services. But clinically, I continue to practice obstetrics and newborn care here in the hospital, and I do that about 2 days a week on average. So my role has shifted within the organization. My clinical scope has shifted multiple times as far as what I do, but I've been here for now about 17 years. To me, there's nothing more rewarding than fixing something that's broken. I think maybe if I'd grown up in a different era or maybe in a different situation, I might have been a mechanic or an engineer. With medicine, you get the added layer of the broken thing is a real living person with a name and a birth date, and they need your help. And so every time that you take whatever was broken and fix it, it's not, there's nothing wrong with making someone's car run, but it's particularly satisfying when it's the mechanic that you're fixing. When you're working in a smaller community, there's a human scale to it that's just different. The person that you're taking care of isn't your neighbor or isn't somebody that you work with, on a community board, or that you don't, if it's not somebody that you coach Little League with, it's their cousin, it's their mom. The degrees of separation are so few that the people that you're dealing with are not nameless, faceless entities, and you're not a nameless, faceless entity to them. There's a humanity to it that's different than if you're working in some place that has 1,000 physicians and 10,000 beds. I've been here for 17 years, not yet delivered a baby for a patient that I delivered yet, but I'm getting old enough that that's probably around the corner for me, and probably not too far down the road. So, and that'll be a whole nother level. Yeah, it's definitely a huge upside. The way that prenatal care, and especially the way postpartum care is delivered in most of the United States, is utterly broken. And everybody recognizes it, and everybody says it shouldn't be that way, but nobody really seems to have a lot of ideas about how to fix it. So we set about crafting, a new way of doing things. We came up with what we call the OB newborn clinic. Just because someone's pregnant doesn't mean they don't still have asthma. And their asthma still needs to be managed, and it needs to be managed well, because you are quite literally breathing for two, right? So if you can't breathe, neither can baby. If mom has high blood pressure, that still needs to be managed, even if she's pregnant. If mom has mental health issues, that needs to be managed, even if she's pregnant. Taking that more holistic approach, that primary care viewpoint, and bringing it to maternity care is a different mindset than the way that prenatal care is approached across most of the country. And then where we really kind of broke things apart was the way we've done postpartum care, which is sometimes called a dyad model, where we see mom and baby together always. The staff all know if mom calls with a concern about baby, you put them both on the schedule. They've been one patient for the last 9 months. They've had a successful delivery, that's great. In many ways, they are still one patient. And so it's very, very difficult to separate a struggling mom and say that has no impact on the baby, right? You can't really, if you have a baby that's failure to thrive, how does that not have an impact on mom? That dyad approach has been transformative in the way we do postpartum care. It's not the only difference, but I think it's the most recognizable one. When people have delivered elsewhere or had postpartum care elsewhere, it's changed that. And so the opportunity to have that impact, it was more temptation than I could bear, I guess might be a fair way to phrase it.